Hello, I'm Dr. Lucy McKay. I'm the CEO of Medics for Rare Diseases, and I am so excited to be here talking to you about Rare Disease 101. Rare Disease 101 is a free-to-access, online and interactive medical education module. It's aimed at medical professionals, particularly those in early training years, like medical students and doctors in training. However, really, it is there for all medical professionals. The purpose of Rare Disease 101 is to teach you the basics of rare disease so that you as medical professionals can start to help reduce the diagnostic odyssey and improve patient care for people living with rare diseases. It's really been in the making for years, especially inside my head, and it's been on the wish list of Medics for Rare Diseases for a long time. And then it's literally being created with lots of clicking by myself and Dan Jeffries, the trustee of M4RD for the last year. So we're really glad and excited that we've got it here for you now. So it's 16th of Feb, it was launched. And so straight after this event, after all the talks and the panel, you can go and check it out and you can take the course and become a rare disease ally. We couldn't have created it though without the experts and without contributions from all over the rare disease community. We had Dr. Gareth Bainham from Western Australia, who's a clinical geneticist. Gemma Chandra-Talaka, who's a molecular geneticist, the chair of Cambridge Rare Disease Network and many other things. Find a Cure, the brilliant patient advocacy group. Rare Revolution, who talked to us about supporting patients, as well as the beautiful illustrations by Sarah Lippett from her graphic memoir, A Puff of Smoke, and also Emotive, who kindly give us their expertise as a globally known medical communications company. They're behind our branding and so much of the beautiful imagery you see in Rare Disease 101 and Medics for Rare Disease in general, and we can't thank them enough. We also are really privileged to be able to include quotes that were provided by people living with rare conditions to Genetic Alliance UK and used in their Rare Experience 2020 report. We're so grateful for these because it's really important that when we're talking to medical professionals, we're really reflecting the patient experience. This isn't about M4RD, this is about creating a platform in which we can bring that true experience to medical professionals to help inform their clinical practice for the future of people living with rare diseases. The 3.5 million people in the UK living with rare diseases, many of whom are children, many of whom had a delayed diagnosis. And you'll learn more about that in Rare Disease 101. So why is Rare Disease 101 needed? For the last 10 years, there have been serial reports taking the accounts of people living with rare diseases. So we have a good understanding of the unmet needs there are for people living with rare diseases. But these unmet needs haven't really changed over those 10 years. And that's despite really concerted efforts and focus in this area and new innovation within diagnostics and technologies. Just in January 2021, the new UK Rare Diseases Framework was published by the Department of Health and Social Care. It really took a lot of information gathered and took it down to 4 priorities. 1, helping patients to receive an accurate diagnosis faster. 2, increasing awareness amongst healthcare professionals about rare disease. 3, having better coordinated care for people with rare diseases. And 4, having improved access to specialist care and to treatment. And these 4 priorities were also echoed by the Genetic Alliance UK report that I mentioned earlier, the Rare Experience 2020. So we know what the unmet needs are. They haven't really changed, but they're still unmet. And so what we need to think about is why. And you'll notice that all 4 of those priorities from the Department of Health are around healthcare. And I believe that priority 2, increasing awareness amongst healthcare professionals, is the key to unlocking the other 3 priorities. I do believe that although this isn't the golden bullet, what we can achieve by solving problem 2, priority 2, could be quite extraordinary. That's where Rare Disease 101 comes in. Because how can you, as a medical professional, be expected to implement the change that will be prescribed in action plans following this framework when you don't even know the problem exists? If you don't know about these unmet needs, if you've spent your entire career being told common things are common, without really being told about rare diseases are common too, and they have very similar challenges between different diseases. So Rare Disease 101 is there to give you these basic fundamental principles of rare disease, and without going into depth about any single rare disease. So this is one approach we can take to medical education in order to help priority 2. Not only will you then be able to help the implementation of the action plans, but also you can help us understand why you think these unmet needs continue to be unmet. So let's take a look at Rare Disease 101 now. Okay, so now I'm going to take you through lesson 1 of Rare Disease 101. This is all about introducing rare diseases and using some statistics to help you understand why they're relevant to your clinical career. So a rare disease is one that affects fewer than 1 in 2,000 people in a population. That's according to the European Commission. Prevalence is just one way of defining a rare disease, when actually, is the disease rare or rarely diagnosed? Do we definitely know the incidence of certain diseases? So sometimes it's often better to think of this disease has commonalities with what happens when you have a rare disease, because there's lack of information. There's not a clear defined diagnostic pathway, or maybe there's not great treatment options. For example, Ehlers-Danlos is arguably not a rare disease, however faces many problems similar to very rare diseases. Over 7,000 rare diseases have been described. This makes it quite a challenge to teach about rare disease in the medical curriculum. It would be unfeasible to cover 7,000 rare diseases in any depth, in any way in a medical curriculum. However, this doesn't mean we can skim past a population of 3.5 million people in the UK. So we've got to find somewhere in between. Somewhere between, the knowing the minutiae of 7,000 rare diseases and going, this is too great a hurdle or it's too difficult to do, and not cover it. And that's what we think Rare Disease 101 is. So I've just mentioned 3.5 million people are estimated to live with a rare disease in the UK. This is a really large population, many of whom would be under paediatric care, and all of whom will have a GP. When you think about this large number, I hope it makes you think about, do I know in my practice who has a rare disease? Or do I feel like I've come across that many people who have a rare disease that reflect that statistic? Because actually, the lifetime risk of having a rare disease is 1 in 17. 1 in 17 people will be affected by a rare disease in their lifetime. And I think that really brings it into sharp focus that rare diseases are relevant to everyday clinical medicine. So now we know rare diseases are individually rare, but collectively they're common. We need to be expecting to see patients who have a rare disease, and we need to know when to suspect someone might have a rare disease. You might not know which one, but you can put together a clinical picture that makes you think, I think there's something else going on here that I don't know about and I need to ask for help. And that's what we try to show you in Rare Disease 101 and give you some extra tools under your belt so you can do that. A good place to start with Rare Disease 101 would be in child health, with 81% of rare conditions starting solely in childhood or in childhood and adulthood. And actually, sadly, 30% of those affected by a rare disease will die before their 5th birthday. Approximately 80% of rare diseases have a genetic origin. This doesn't mean that they're always inherited down from the previous generation, because this could be due to a new mutation. Also, it means there's 20% of rare diseases that don't. And therefore, we can't think to ourselves, oh, rare diseases, that's a genetics thing, it comes under, the geneticist. And I think this is one of the problems out there for people trying to navigate the healthcare system with a rare disease. Their condition may not have a obvious and natural home within the NHS, and therefore they can be left to manage their own care, talking to multiple specialists separately with no cohesive point in the middle. Arguably, a GP could really take this role on for them and help relieve this burden. Currently, 9 rare genetic conditions are included within the newborn screening programmes of England, Scotland and Wales, and 5 in Northern Ireland. So, these diseases have been specifically chosen based on criteria. However, I want to point out this statistic because if you ever thought to yourself, oh, it's rare, therefore it would have been picked up in the Guthrie test, or, oh, it's genetic and therefore that would have been picked up at birth. That's not necessarily the case. And actually, 9 rare genetic disorders you now know is just a drop in the ocean when there are over 7,000 rare disorders and not all of them are genetic. This next statistic is the really important one. For us, this is what we want to change, and everything else will hopefully start falling into place. A person living with a rare disease will, on average, wait over 4 years for a diagnosis. They will often see many clinicians, both in primary and secondary care. People report having misdiagnoses and being mislabeled as having mental health problems. People also, sadly, do receive the wrong intervention due to misdiagnosis or diagnostic delay. And later, you'll be hearing about the importance of a timely and accurate diagnosis so that patients can go on and harness the power of research and of therapy that could change their lives. So, we hope that you'll take Rare Disease 101 and you'll be part of reducing that diagnostic odyssey. And lastly, I want to emphasise again that even the most different rare diseases can have such similar consequences. I've now been putting on rare disease education of some type, asking specialists, whether those are patients, clinicians, scientists, coming to talk to medical professionals for now 10 years with the help of my colleagues. Over this time, we have heard about so many different conditions affecting so many different types of people, and yet over and over again, we hear the same challenges come up. Diagnostic delay, uncoordinated care, lack of access to research or treatment, lack of support, being diagnosed as having mental health problems rather than their rare condition, and then being too scared to seek help for their mental health problems that are caused by their rare condition. Being left to feel isolated. We can do something about some of those things. Today, tomorrow, we can do something about those things. So I hope what you will understand from this and from Rare Disease 101 is whatever role you play in a rare patient's journey, you could be the one who makes all the difference. So please go out there and #DareToThinkRare.